Feeling done?
Feeling done.
Yeah. It's looking more like that just by your facial expressions.
It's like, come on, I'm waiting and waiting.
So am I.
Yeah.
Not as much as you, but yes. Alright, so baby's been active?
Yes. Still moving even now.
So your urine looks good again, blood pressure looks good, no headaches, swelling in the ankles, or not really?
Not really. A little bit, yes. I think it's the water already. Like,
Yeah.
Some cramping.
yeah, I had it like
Yeah.
today in the morning. In the afternoon.
Let's check the baby out here. She's still pregnant.
She's pregnant, big time.
Big time.
Doesn't help her. One of our friends just had her baby today.
Uh-oh.
Yeah.
Where'd they deliver at?
Madison.
Madison. Okay. $130. 130s. Sounds good. So the question I have for you. So you're 39 weeks, 1 day along right now. So we have some options. You beat me to it. Good man. We have some options. We could, well, let you alone and see you next week, assuming you're still pregnant. And then at next week's visit, if you were still pregnant, we could check your cervix and decide when are we going to help you, assuming you continue not to go into labor without help. So in other words, typically we will plan to help somebody by inducing them if they are 40, 41, or 41 plus weeks along. You're 39 weeks 1 day today. I don't have any medical reason to force it technically, but at some point we know that the risk actually of letting the baby stay in there indefinitely gets greater than helping you out, and you're going to certainly want some help eventually if nothing's happening. So ideal world, baby just decides it's time, something happens, water breaks, or you start contracting and the cervix starts to change and we're in good shape and we never even had help. Or we have to help maybe a little bit while you're in labor, but you got into labor on your own. All good intentions, though, sometimes it just doesn't happen and we have to help you. So usually I like to help people somewhere between 40 and 41 or 40 and 41 and a half weeks. But part of that depends on kind of your tolerance of how long you want to stay pregnant too. Realizing still the ideal situation is hopefully you just go into labor. So if we at least make a plan for a day that we won't go past, but you go into labor before then, great. If you don't, at least we know what day we're using, and the OB department knows when we're using it, so that way we don't suddenly get to be really close to the day we want to make something happen, and then we call them, they say, well, that day we got a C-section on somebody and we can't do it, and because they like to only do one planned induction or C-section per day, and they don't like to do them on a weekend. If you come into labor on your own, that's one thing, because we can't stop that. But someone where we're forcing the issue or planning a C-section on, those situations, they only like to do one a day on a weekday. So that's why I'm trying to think a little ahead, and trying to plan for when do you want to do something no later than. Like what date no later than do you want to have a baby?
No later than 20th, I think.
20th? Okay.
Yeah, no later than 20th.
So today being the 4th, so So then I think what we do is we see you next week, assuming you're still pregnant, either Tuesday or Wednesday, one of those days, because then on Tuesday you're 40 weeks,
Yes.
on Wednesday you're 40 and 1. And then we maybe shoot for one of these days because that would put you around 41 weeks. And here, yes, you're 41 and 1/2, but a lot of times that there's a small chance that if I plan for a Friday, so Thursday I'm not in clinic, so I don't like to do them on Thursday because I'm not in the clinic. I'm not right here. And Fridays, I am not a big fan of Fridays because if 2 people suddenly Thursday night come in labor and they're kind of swamped suddenly, they're going to push us back. They're going to say, well, maybe she can come in late on Friday, or maybe we'll have her come in on Saturday because it gets too busy sometimes all of a sudden when we got a plan for what we want to do, and some other women decide they're going to have kids, so they come up and they're in labor. So it pushes us back a little bit. So I think that way, if we plan for one of these 2 days, this is all assuming you're still pregnant here. We plan for one of these days and suddenly they get busy and they have to push us back a day, we're still sometime during this week. So I say we see you next week on one of these days, and that's of course if we don't deliver before then. And then we'll check your cervix that day to know, is anything happening, even though really the whole thing's not happening yet, but is anything happening? Like, has the cervix gotten a little more ready or not? Does it feel like it is? How am I going to help you, presuming nothing happens between this visit and when we do something? So we've got a plan in mind, and then at that point, next week, I'd call OB for the following week to be able to tell them, okay, would X day work? Would the 17th work? Or would the 18th work? What do you have available? Here's what we're going to do. It's a first-time mom. I'm going to do the following to help her get into labor, assuming nothing changes. So that's how we could plan it. So now, hopefully, all this discussion is for nothing because you just go into labor.
I hope it too.
But, we don't know. And so far, everything checks out fine. Baby sounds good. You're measuring fine. You're not having a lot of puffiness, which is great. Overall,
I had like 1 or 2 days, I had like some pain on this side, like a needle.
Sure.
I don't know what,
so,
just for a little bit.
Short time, yeah. I mean, potentially that's baby positionally the way they're sitting. Sometimes, too, when they're trying to, in a sense, get into the most appropriate position, they sometimes will cause some irritation, although that might last a little longer than what you're describing. I can't say that wasn't actually maybe even your bowels, because on that side, of course, our bowels, through our abdomen, as much as everything's getting pushed out of the way right now with the baby being there, it could have been bowels, but it doesn't sound classic for that either. So it doesn't sound worrisome. Baby's active, you're not bleeding. So I don't know for certain that I can tell you what's definitely doing it, but it almost sounds more ligamentous or baby related. So I think we stick to that kind of a plan, and then we just hope that you go into labor and we don't have to have any of that happen anyway.
And with those short episodes of when she's kind of really, abdomen is really firm, like for a very short period of time, it's absolutely really firm.
Tight,
I'm not sure what
So how long does that last when you notice that? Seconds only, or?
No, like almost a minute.
Okay. And so do you notice that happen, and then you get maybe 4 or 5 minute break, and then it happens again, and then a 4 or 5 minute break, or is it maybe it happens, then it's 30 minutes, and then it's an hour, and then it's 5 minutes?
More like that, yeah.
Yeah, so that's Braxton Hicks. That's a type of a contraction in a sense, but it's not.
So when it's tight and here.
Yeah.
What about the pain? Like I have, sometimes I used to have like a little pain down.
So that still could be related technically. The upper stuff sounds more like truly a contraction, but it doesn't sound like your pattern is consistent to call that labor. That just sounds like some irregularity.
It's not painful. It's
just pressure more, and tightening. Yeah, that's not. That sounds like almost like a false labor pattern essentially, and then even the discomfort down here either again is trying to show evidence of that, or it's again baby in a sense jockeying for position the way it needs to line up. It doesn't sound worrisome. It sounds more annoying than anything, because you'd prefer just the real deal happens and this gets rolling, but we're getting there.
Yes.
It's coming.
We're not going past that week though.
No.
Something's gonna happen.
So 17th or 18th?
Somewhere in there, yeah, I think so.
No, even earlier. I wish. Not on 14th.
Yeah, I mean, well, we'll see what happens, you know, by next week, obviously, but then we'll figure out based on what your cervix feels like how easy it's going to be to help you get into labor, and we'll just plan based on that. So, okay?
Sounds good.
Hopefully, I'll see you before next week.
I hope it's like Saturday sounds good.
Saturday sounds good? All right, I'll clear my schedule. We're good to go. Have a good day.
Thank
Thank you.
Too.